In this video, I'm covering 10 Medicare myths and what you should know about these untruths that are out there regarding Medicare. Welcome back. This is episode 198. In this week's episode, we're talking Medicare. Specifically, I'm busting 10 Medicare myths so that you know fact from fiction when you're turning 65. But before we get into that, as a reminder, if you're serious about getting a plan in place for retirement, then consider signing up for my online retirement planning course, Retirement Readiness Review. It's an on-demand video course where I educate you on what you need to know about planning the ideal retirement. I cover taxes, Social Security, Medicare, investing, estate planning, and much more. To learn more, head over to retirewithryan.com and click on courses. So we're going to cover 10 Medicare myths, and the first Medicare myth that we're going to discuss is you have to enroll in Medicare when you turn 65. You may have heard that's what you need to do, and generally this is false. If you have job-based health insurance through either your employer or your spouse's employer with a company with usually 20 or more employees, then you don't have to sign up for Medicare if you're still working and you don't want to, or if you're covered under your spouse's plan. You can wait to sign up until you or your spouse stop working or lose your health insurance, whichever comes first. And one way to check this is that you can check with your insurance provider to see if the plan that you're enrolled in would exempt you from enrolling in Medicare. And the reason that you'd want to do this is that there could be costs that you'd have to pay with Medicare that might not be worth paying if you're still enrolled in your employer-based health insurance. And your employer-based health insurance may also be better than Medicare as well. So this is the case whether you're on your plan, as I said before, or covered under your spouse's plan if you're 65 years of age and older. And if you're self-employed or you have health insurance that's not available to everyone at the company, then generally you must enroll in Medicare because, again, that health plan has to cover 20 or more employees. And if you don't enroll, then you'd be subject to a penalty on your Part B premium, a late enrollment penalty. So you want to avoid that penalty at all costs. So make sure that you enroll when you need to. Myth number 2 is that you are automatically enrolled in Medicare when you turn 65. And this is generally false. You will be automatically enrolled in Medicare only if you are collecting Social Security when you turn 65. So if you start collecting Social Security before your full retirement age, then you'll be automatically enrolled in Medicare. For everyone else, you have to enroll. And the initial enrollment period begins 3 months before you turn 65 and ends 3 months after your 65th birthday month. So if you're not going to enroll at 65 because you're covered by a plan through your employer or you're covered through your spouse's plan and you're going to work past 65, then you have a different enrollment period. You have an 8-month window after your coverage or your spouse's coverage ends to then enroll. And if you don't enroll during that period, then you would also be subject to a penalty. Myth number 3 is that Medicare will tell you when it's time to enroll. And again, generally that's not true. And though you'll get a lot of stuff in the mail telling you that you can sign up for different Medicare supplemental plans, Medicare itself is not going to send you any reminder telling you that you need to enroll. So you need to make sure that you manage this and you enroll. And to enroll, you do this by going to the Social Security website, ssa.gov, and from there you click on Enroll in Medicare. Myth number 4 is that Medicare is free. And this is not completely true. For most people, there is one part of Medicare that will be free, and that is Medicare Part A. Now, Medicare Part A covers part of the cost of a hospital stay. And as long as you or your spouse has worked for 10 years or more in the United States, Part A is usually free. So that will be free. However, many other parts of Medicare are not free. For example, Part B covers preventative care and certain out-of-pocket costs. And with that starts at $174.70 per month. So everyone pays that minimum Part B premium of $174.70 per month. However, if your income's over certain levels, then you might pay even more than the $174.70 a month. And that Part B monthly premium, that minimum premium is set every year by Medicare. So that premium can go up. Some years it actually has gone down, though that's pretty rare. So most likely that will continue to go up into the future. And there's other out-of-pocket costs that Medicare might not cover, such as there's a deductible for a hospital stay, there's prescription drug out-of-pocket costs, there's prescription drug deductibles, and there's other things that Medicare Part B doesn't cover because it only pays for 80% of care. So unfortunately, most of Medicare is anything but free. So myth number 5 is that your income levels affect whether you can sign up for Medicare. And this is absolutely false. As long as you are 65 or older, or if you qualify for Social Security disability and you've been on there for, I believe, 24 months, you then can sign up for Medicare. And however, as I said before, if your income is over a certain threshold, you might pay more for your Part B premium or also more for your Part D prescription drug coverage. However, everyone reaching age 65 in the United States is going to be able to sign up for Medicare Part A and B. Myth number 6 is that having COBRA insurance allows you to delay enrolling in Medicare, and this is false. So COBRA insurance covers you if you leave a job through getting laid off or through retirement and you want to continue your employer health coverage. That's called COBRA insurance, and you pay for that out of pocket. However, if you keep your COBRA insurance, let's say, past age 65, this doesn't allow you to be exempted from enrolling in Medicare. In that case, if you retired, let's say, at 64, and now you're turning 65 and you're still on COBRA, you're going to need to enroll during that initial enrollment period, or else you're going to have to be potentially subject to penalties on your Medicare Part B and Part D premium. So make sure you enroll if you're on COBRA insurance. Myth number 7 is that you should enroll in Medicare Part A as soon as you turn 65, even if you're still working, because it's free. And I would say this is generally not true. So this can be okay if you're not on a high deductible health plan. So why is that? Because with high deductible health plans, you're generally eligible for a health savings account or HSA account. And you're eligible to contribute into that and take a deduction on the contributions, and then your employer might also be putting money into that. So as soon as you enroll in Medicare Part A, that automatically disallows you to make any further contributions to your health savings account, and also prevents your employer from doing it. If you or your employer make any contributions going forward, you're subject to a penalty on those contributions. You also have to remove, as soon as you do enroll in Medicare Part A, any contributions that you've made into that HSA in the prior 6 months, or employer contributions. So if you are planning to enroll in Medicare, you would want to stop your HSA contributions, both yours and your employer's, up to 6 months before you're going to enroll. But this is a major misconception. I hear people all the time that believe this and enroll in Medicare Part A. And if you do that and you are in a high deductible health plan, and let's say you were going to work another couple of years, you're going to work till 67, you now cannot contribute to your HSA account during that time frame. And that's a big loss because these accounts are very beneficial. They give you a pre-tax deduction. You can invest the money and it grows tax deferred, and then when the money comes out, it's tax free. So make sure you don't make that mistake if you're contributing to a health savings account. Myth number 8 is that Medicare Advantage plans are expensive. This is generally not true. Medicare Advantage plans are offered by private insurance companies, and they receive payments from the government to administer these plans. So they receive money from the government for each individual that's signed up for these plans. And these insurance companies then choose what to offer in these plans. They choose to offer a certain network of doctors, certain prescriptions. They might offer other services like gym memberships and dental or vision, and they choose what to do that, offer in those plans. So for these plans, they're, from what I understand, pretty profitable for most insurance companies, so they want more people to sign up for them. So because of that, many times these plans will have a very low monthly premium and sometimes even be free. So if you're looking for the least expensive coverage, Medicare Advantage plans are actually going to be usually the least expensive. Myth number 9 is that Medicare Advantage plans are better than Medigap plans. And this is generally not true as far as what they cover. Now, I said earlier the cost is less, but with the services that you receive might also be less as well. So when you're looking to get supplemental coverage with Medicare, because you have Medicare Part A and B that everyone will enroll in, but there are things that, as I mentioned earlier, Medicare Part A and B don't cover. So if you're looking to get supplemental coverage, you can sign up for either a Medicare Advantage or a Medigap plan. Now, with Medigap plans, they're standardized by the government as far as what these plans have to offer. And there's different letters assigned to them, such as Medigap Plan A, Plan B, Plan C, etc. And this dictates what's offered in the plan. So if you're comparing a Plan A offered by Aetna versus Cigna, the plans themselves are 100% identical. So the most comprehensive Medigap plan that you can buy is Plan G, but it's also the most expensive. So with Medicare Advantage plans, as I mentioned earlier, what they offer is not standardized. The insurance company, the private insurer, decides what to offer in these plans. And generally, when you compare these plans, as far as what's covered, the out-of-pocket costs are generally higher, potentially with a Medicare Advantage plan, if you have a prolonged sickness or hospital stay. Whereas with a Medigap plan, the out-of-pocket costs are usually less. However, the premium could end up being more. So if you compared Plan G with most Medicare Advantage plans, as I said, Plan G would generally cover more, and you might actually get a lot more out of it too, even if the premium was higher. So this is an election that you have to make when you retire to make a determination which one of these plans that you go with. And that brings me to our last myth, myth number 10, and that is once you elect a Medicare supplemental plan, either a Medicare Advantage or a Medigap plan, you're stuck with it. And this is false. Every year, from October 15th to December 7th, is known as the Medicare annual enrollment period. And during this time, you can switch from one Medicare Advantage plan to another if you're not happy. Maybe the Medicare Advantage plan you were with decided to stop offering certain prescription drugs that were covered, or they changed the doctor network, or a certain benefit they offered they removed. So that allows you during that time frame to switch from one to another. It also potentially offers you the ability to switch from a Medicare Advantage plan to a Medigap plan. Now, in some states, like my home state of Connecticut, you can switch from a Medicare Advantage to a Medigap plan without worrying about any pre-existing conditions preventing you from doing that. And what do I mean by that? When you switch in many other states or try to switch from Medicare Advantage to Medigap, the insurance company has you fill out a pre-existing health condition questionnaire. And if you answer yes to certain questions, like, for example, if you had cancer before, they might tell you can't go into the Medigap plan. And this is one of the only instances right now where insurance companies can discriminate against you for pre-existing conditions. But in some states like Connecticut and a few others, you can actually switch from Medicare Advantage to Medigap during the open enrollment period because the insurance companies cannot prevent you from switching due to pre-existing conditions. So if you live in a state, however, where they don't allow that, then you might want to go right into a Medigap plan to give yourself the best coverage throughout your entire retirement. Now, there's obviously potentially more cost with that, but it could be a better decision for you financially over the long term if you ended up having to pay less out-of-pocket money for that plan. So again, Medigap is usually going to be more comprehensive than Medicare Advantage, and during that open enrollment period, you could change from one Medicare Advantage to another, but you might not be able to go from Medicare Advantage to Medigap depending on the state that you live in. So I hope this helps bust some of the Medicare myths that are out there. And as always, if you have a question that you'd like to have considered for a future episode, head over to retirewithryan.com and click on Ask a Question. Have a great week, and I look forward to talking with you next Wednesday. Take care.